Hello everyone, this is Dr. Rohitha, consultant gynecologist and IVF specialist at Motherhood Hospital, Kothanur branch. Today we have a patient who has few questions regarding IVF. Let us hear her questions and try to answer them.
Hi doctor, it's nice to meet you. I have few questions regarding IVF. I'm trying to be conception since so many years, and now doctor has suggested me to go for an IVF. So I'm very scared about the procedure, and I have a lot of questions, a lot of thoughts regarding this. So I just want to know, what is IVF exactly, how it is different from the natural cycle.
So it's quite common that you are anxious about infertility and IVF process. Globally, infertility is on the rise, and IVF is a very common procedure that is prescribed these days. So basically in IVF, we take out the oocytes from the woman's body and we take out the sperm from the man's body and we try to fertilize them outside. When we make the embryo, we put it back inside you. That is inside your uterus to grow in vivo.
So now I have one more question. I have underwent multiple cycles of IUI as well as natural cycle. Once I undergo IVF, will I get pregnant? Definitely.
I understand. See, there is a lot of difference between ovulation induction cycles, IUI cycles and in vitro fertilization. In vitro fertilization, we target more number of oocytes. So basically in a woman's body, every cycle will give one oocyte, but in IVF through hormonal injections, we try to get as much as oocytes as possible and we try to fertilize them outside. Coming to the success rate of IVF, it is definitely not 100%. It depends on so many factors, male factor and female factor, both the factors. So globally, the success rate of IVF is around 40 to 50% and not more than that. So coming to your case, the tailor-made approach is the most optimistic and best way to give you the success rates.
Once I get pregnant, should I be under bed rest throughout pregnancy? Because I have heard a lot of stigmas around IVF pregnancies and so many things people will tell. So is it mandatory?
It's quite a common misconception that IVF pregnancies need bed rest and we give a lot of injections. No, definitely not. IVF pregnancies are almost similar to the normal pregnancy. For example, it might be a little high risk than the normal pregnancy, but not such a high risk that all IVF conceptions need bed rest. Only in few conditions where cervical incompetency is there, or maybe the women have had previous miscarriages. Only in some conditions we give a lot of injections and we advise bed rest, but definitely not all pregnancies.
Okay, doctor. Now you cleared all my doubts and I can prepare myself for my next journey, I think. Thank you, Dr. Rohitha, for all the information.
Thank you.
Motherhood Hospitals. We care like no other.